My name is Franklin Mtei, as it has been introduced here. Uh, I'm the RTT at Ocean Road Cancer Institute, but here today I'm standing as a patient advocate from Inspire to Live, which is an organization that's international for patient advocates, the people who speaks on behalf of cancer patients, because they know the language of the system, they know the language of the industry, and they know what they're going through. So I will have to explain a few things, but rather I will start to give some different ways in which advocacy can be done through a story that is inspired by a certain little baby that you're going to see in the next slide. But usually, people in the congregations like this expect the conclusions to come at the end, because they will not wait to see everything going as planned, because sometimes things get boring. But today, I'm starting with the conclusion, and then I'll be going all the way up untraditionally, because as an artist, I haven't introduced it myself. I used to believe, and I still believe, that things can be done differently with better outcomes than you expected. So a wise man once said that we recognize that cancer and its associated complications transcend ethnic, geographical, political, cultural, and religious boundaries. And it requires the active participation of the whole community for its control, reduction, and eventual eradication. And that by virtue of their flexibility and adaptability, non-government organizations, advocates, and patient advocacy groups are in a better position than the government organizations to experiment and innovate for the development of effective intervention strategies. So we further recognize share the following concerns. This is a story of the Tanzanian Cancer Society and how it started. But we all know that cancer, with its cruel reality, is a common foe and has to be faced squarely as soon as its warning symptoms are recognized. So cancer, by its very nature, is not only it doesn't only consume the flesh, but also the mind, the spirit of the victim, and erodes the whole family, not only psychologically, but very often financially. So choosing wise, as is the topic here today, we expect that we will find different ways, first of all, to understand what our people are going through and what we can really do more effectively, individually, starting from an individual point of view. This is a little boy I'm talking about that once upon a time, he had dreams of doing some big things. And because being a child, as he was in a place where a lot of people haven't been educated, he went on to become the first little kid from the streets of Kenyatta to do something that's awesome, because he believed that he could do things, and through different ways of survival mechanisms, where most of the people around him used to be burglars, and some were killers, and everybody let you know the gangsterly type of lifestyle. He was determined to do the big things all by himself, being as like a major player in ensuring that people can do things and motivating others, because he used to motivate himself. And here's a story about the Tanzanian Cancer Society and how it came about. Back in 2008, before I was straight after of the medical school, like anybody else in Tanzania and most places in Africa, I didn't know that cancer can be cured. So in 2008, when I was employed at Ocean Road, I came across different ways in which I learned the reality about the cancer. First of all, I didn't like to work in that place because, as many Tanzanians, I believe that cancer is incurable, and I wanted to do something big. And as a medical personnel, you wanted to help people saving lives, but actually working in a place where people die, it wasn't my cup of tea. So what I did was that I was reluctant to join there, but there are so many forces that were involved for me to be in that place. And the inspiration from my dear brothers who insisted me to be there is probably it's a call from God that they wanted me to be in that place so I could do something so as to inspire people. Because I think being an artist and not liking to see things just go the way they do, because I do believe with an artistic eye, you can see things differently and you can improve on many things that haven't been there before. So being there in that place, I came to learn the reality that cancer is curable and that early detection is key. And the cancer education is what was really missing. So I started, first of all, it was different when I was trained as a trainee radiation therapist. I saw patients that were very devastated, and they were looking for some simple gestures of life, like a listening ear and a little bit of attention and caring. So being a newbie in the place, they can notice a difference when they see a person that is a little bit more dedicated to the cause by asking a little bit of question and knowing how they are doing. I didn't mention that I'm a seminarian, so I was starting to save people's lives spiritually, but then again to the hospital so I can save their body and mind and souls at the same time. So being that different, and I think many people are different as well, it was easier for the patients to approach me and tell me, I'm asking me things that were even where they weren't even able to ask other medical personnel. So as a radiation therapist, like I said before, we sit and we stay with these patients for almost as good as 4 weeks after they have seen their doctors. They stay in the radiation therapy and they keep coming and going at the radiation therapy. So you can notice the differences and you can know that this patient needs some kind of a help because you got time, because during that time we had very much queue when it comes to waiting times for treatment. So we had a lot of ample time, and we still have ample times to talk to patients. So I used to take that opportunity to talk to patients, and they used to tell me things that I couldn't even afford to help. So I was trying to put my ideas to the authorities and recommended some resolutions and what we could do. But sometimes it's difficult because the budgetary and other personnel-wise, the shortage of everything that we had as a government institution, and a lot of patients per doctors. So it was difficult to implement many things that I thought could be implementable. So fast forward 4 years later, I went to, before I was graduating at Muhimbili as a radiation therapist, I formed this group of people, my classmates, where we decided that we could do something because if we created an organization that's non-governmental to complement for things that can be done, we decided to register an organization that's called Tanzanian Cancer Society. And it's few of the things that we thought we could do, a lot of things that could be done without money. It's just a matter of time, because when you have like 15 minutes in a day, you can post and share something that you already know, because most people who came in the hospital, they came at a very late stage, which was difficult for them to be cured. So when you ask them the basic question that they didn't know, was that they never knew anything about cancer that is curable, and they thought it was something that is a curse of some kind. So we thought education was key in each and everything. So we had our social media handles and the social media platforms we could use to put the information out there, basically in Swahili, because that's the language spoken by many. And when people go to the internet and they search for cancer information, it was difficult to get the Swahili ones. So we started doing that, and this is our vision. It was to create the world where every person in Tanzania will have access to the best possible cancer services. this is the place of advocacy. And as my topic today, in advocating for Africa, you could just advocate for the best possible cancer patients in your own position and time. And another thing in our vision was that for the person in Tanzania with cancer, having being able to get access and best possible cancer services, and the person will have the lowest risk of getting cancer, which is another kind of thing that we are advocating for, and you can do the same as well. So we ensure that the highest survival rates for those patients who unfortunately have got cancer. But again, the best information available when affected by cancer is something that we're striving for. So it's Choosing Wisely. They have the website and the materials for cancer information. So do we, and we try to put the Swahili versions as much as we can, usually for free, because so far we have never been funded. So as my presentation today is about Africa, I will cite some things that Africa is going through, and that as Africans, I think we should have to know that Africanism and Pan-Africanism is something that is not very new in this day and age, because there used to be great minds, African great minds, who have more and more been insisting that Africa should unite and do things the African way. So I will mention a few, and then I'll suggest some things that can be done. So many people don't know that Africa is a continent. It's not a country. And it was separated by the colonialists. We have many languages, over 2,000 languages, and unfortunately, I don't know, such as it is, we adapt to the world, the way the world is going. We use English in higher learning institutions, but in our primary institutions, and like in Tanzania, we use Kiswahili. But having seen that the language for the majority is Kiswahili, then I wonder how our doctors who are educated and they know a lot of cancer, what are they doing to ensure that the Swahili cancer information is out there for the majority of our people. So we have our solutions that must be different. Our interventions on medicine should be personalized, because most people, as far as cancer fights and developments are concerned worldwide, we know that people in Europe have been able to develop many cancer drugs, but they work wonders to them, and in many cases, they really don't conform to what our DNAs are, because the different outcomes that we have. So you can advocate for personalized medicine. So Africans are more religious than the religious people themselves who brought them here. So if we could use religions to advocate for cancer, the people will really understand. And then there's another thing, like we are extended families. When cancer affects one of us, it affects all of us. So in case we fail in the ways that we advocate for cancer awareness and prevention ways, we should know that these things haven't just come to here from nowhere. The history itself, the people are learning from experience. The rate of illiteracy in Africa is estimated to be around 40, and only 60% literate. So if you go to your universities in and outside Africa, and you come in Africa and you try to do the European ways of solving things, it really doesn't work for us, because you have to think that the people you're dealing with, most of them can't handle the big information that you do. And that's the reason there's a need for patient advocates and the people who will be the bridge between the healthcare system and the rest of the thing, and the other people, the Africans. So it's clear that we must find an African solution to our problems, and that this can only be found in African unity. Kwame Nkrumah. So as medical personnel, it's our duty to heal the world, like the great Michael Jackson used to say. And I see some people trying to slumber right now. So I think this song is popular. We can sing all together. I'm not a singer, I'm a rapper, but we can do this anyway. We all know this song by Michael Jackson. It has to inspire us to do more. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. So it's our duty to make the world a better place for to ensure the survival of the human race. So my point today, as medical personnel, I know that people have different talents and backgrounds, and we are here in the world for a reason. So going to medical school doesn't mean that you have lost your humanity, your sense of childhood, the desires that you used to have. You can incorporate the talents that you have and do bigger things because you got followers nowadays in this age of digital world. Everybody of us has some accounts on Instagram or Facebook. So we have followers who believe in you and who can really learn a lot from you. So you can use those as your handles, and it could be a source of information to the people around you, and we can change the world that way. As for the students, I'll have the recommendation of branding yourself through the social media, LinkedIn. You can find a problem that you can solve because you can we have like more than 100 cancers. And we have like so many problems that we need to be resolved. You can choose that and you can brand yourself. You can read about those and you can even suggest and advocate for all those things in order to make a change. So I will define the patient advocacy as any activity which ultimately benefits the patient. So this definition encompasses a wide variety of activities, organizations, and individuals. So it could be one person, it could be an organization, or even the government organization that stands for better patient services. It started in USA in around 50s and gained momentum in the 70s, and it has been utilized in early 2000s by individual patients. These individual patients and organization could do things like professionalization of this activity. You can do things like health equity guidelines, fund research, and even lobby for the new laws. Currently, I am a patient advocate with Inspire to Live, and one thing that we insist is that if patients, the people that are putting us in work, we should believe that if anything that's concerning the patient has to be involved. So for many years, the patients have been left behind, but in this day and age, we advocate for patient centricity. The terminology that means when it's about a patient, then it doesn't have to be without them. You can't make decisions about a patient without involving them on the table of communication. So patients have their own needs, and you just don't have to say what you have to say because at least you have to learn and listen. So my first words beside the baby there was collaborate and listen. If we collaborate, all of us, and then we could listen to what patients want, it's probably that's where we have been failing all the time. Because we keep telling patients that you just go take this medication, take this and take that, but you don't really listen to what they are offering. And we understand the reason. We have so few doctors and the patients feel privileged after the long way they have had to face. before they came to see a doctor. So they are afraid to ask questions, and they're afraid to talk, and they don't even know what to talk about. So if you give them a chance and listen to them, it could be the easiest way. But if you can't, actually, the patient advocates are there for that matter. So if it's about us, not without us, involvement is necessary. And as medical personnel, we can do better. We can just keep doing things the old ways. Because through patient centricity, we'll have to understand exactly what our patients are going through so we can improve on each and every aspect of the things that we do. So while you're becoming, in your road to becoming a patient advocate, you should never give up, because a lot of people will misunderstand you, but you have to stand your ground because you're doing the right thing, respectively. So Inspire to Live is the organization that has about 40 people from different countries, 40 countries representing there, with over 80 people who are patient advocates. They are experienced in what they are doing, and we are very glad that we are trying to reduce the gap that exists between the Europeans and Africans, so that because we all know that cancer patients are all the same worldwide. So I'm representing them in Tanzania, and there are a lot of programs that we think could come in handy, especially when it comes to pain management by the use of lidocaine, while most people here, in our countries, have been using the morphines. So lidocaine is something that we are working on, ensuring that the experts are coming to train our doctors about the existence of that and how we can use it. Again, the liquid biopsy thing that you can just test cancer by just like you're using to test for other laboratory procedures, multi-cancer early detection programs, kind of the programs that Inspire to Live will be working to implement in Tanzania sooner than later. So as Africans, I still believe that I'm insisting that these are the people who used to keep insisting that Africanism is very important, and that we need to think things in our own perspective, because right now we really can. So you should emancipate yourselves from the mental slavery. None but ourselves can free our minds. This was said by Bob Marley, and probably you cannot sing this right now. This is the slide that was the most important part, of paramount important, because it shows that as healthcare workers, we haven't been really doing enough, because an example of the source of information that patients have been going through when they found out about their diseases is that only 3% they have learned from the healthcare team. So the healthcare team is like the list of the people, or the sources of information that people have been getting the information from, which naturally we were supposed to be the ones giving out the information, but we couldn't. So when they do this, is that a person is diagnosed of cancer, the first places they go is through internet, and we find out the social media platforms by 18%, and the internet 24%. They learn from the caregivers, 18% of them, and they learn from other patients, 18%, and TV and radios offer 19%. These are so much higher numbers compared to what originally it was expected to be from. So healthcare teams, we need to do a lot of things to ensure that even these informations that are circulating out there are accredited by what we believe are the right sources. So if we go out there and work together with people in the radios and other patients groups, we can give them the right information rather than the random information that exists there, because it could be misleading. Even caregivers need education. The internet as well need to be filled with the things that we believe that the informations that we offer are well curated and correct. So in our context, in African context, that means in local languages rather than languages that cannot easily be translated. So by the use of this, I go back to the man himself again and say that, how can you be sitting there telling me that you care when every time I look around, the people suffer in suffering? This is Bob Marley, who is, in this context, asking the doctors that you cannot just sit in your hospitals with all the information that you have, because people need to hear something from you. So how can you be sitting there telling me that you care? Well, you know, cancer out there, a lot of people need to know something, and you're waiting there. Just 2%, 2 out of 10 people are only curable, and about 8 are palliative. How are you going to be just sitting there waiting for these people to come at a very late stage while you can do something? So you can use the social media handles, you can go out of your hospital and you can attend these radio sessions and put in the right words at the right time. You can even talk to, you can be invited, now invite yourself in the talks that involve patient advocates and caregivers and advocacy groups, and demystify things that you think are misleading, because those as well have been more creditable according to people's patient perception, that the right information and compassion comes from. In April 13, 1922, Julius Nyerere, our former president, the late, complained about this fact that we educate our people. They go out there, and when they come back, they can't really replicate or just adapt to what we really can grasp from, according to our the information they have, all the experience that they have learned, the knowledge that they have accumulated from outside the country. They say that it's not translatable in our setup. So that's pathetic, because you are supposed to change. You have to conform to what we really do and add on to the values that you have got from elsewhere. So it was like, I can quote this because it's very important. Some of our citizens will have large amounts of money spent on their education, while others have none. Those who receive this privilege, therefore, have a duty to repay the sacrifice which others have made. They are like the man who has been given all the food available in a starving village, in order that he may have strength to bring supplies back from a distant place. If he takes his food and does not bring help to his brothers, he is a traitor. Similarly, if any of the young men and women who are given education by the people of this republic adopt attitude of superiority or fail to use their knowledge to help the development of this country, then they are betraying our union. He said those in 1960s during a Judaism alumni newsletter, volume 7. So in digital world and advocacy, I can only just give one example of what saratani.info, which is an online cancer advocacy program by the Tanzanian Cancer Society, which started in 2017 by offering education through WhatsApp groups and other social media platforms. It's made up of oncology experts and volunteers. It's a bridge between confusing internet and the medical jargon that exists. The cancer education is being offered there 24/7, which we call it Elimu ya Msingi ya Saratani, every Friday with guest experts. We've been doing this for like 6 years now, and we have had like 1,600 members as 2021. And these members are what we call the cancer ambassadors, whom we teach about cancer, different cancers, and many tips about cancer. And they have the duty to share to other WhatsApp groups and their families. So as you can know that if you're having like more than 2,000 people sharing information that you give to other social medias, the amount of the response there is really well. So it's in the Swahili language, social media-based cancer information center of its own kind, and creating cancer ambassadors of advocates, because we believe sharing is caring. And sometimes we used to have seminars online, and these ambassadors we used to meet outside the WhatsApp groups as in offline, so we can talk about things and we can support cancer fighters and patients in the hospitals. So we have our meetings and we even visit hospitals. This is in Hati Ocean Road, and ambassadors at KCMC and Bugando as well. So because the WhatsApp groups are diverse type of groups, we have like many people in it, they represent different regions and different families as well. So I, with my team, we have been creating the new wave of cancer ambassadors, cancer advocates, and we have wonderful people. I think you have seen them in different ways, in different places, being involved, but these people are being mentored by me and my other friends, and these believe advocacy in different aspects can be done, and these are the things that they come up with, and these are some of the people. Took their pictures randomly from the internet, but they can do something. This is Miss Jacinta Samba. She's an author of Caregiver Education and Maisha Baada Saratani, believing that caregivers are the most important integral part that lays between the patient and the medical care team. It's been known that for a fact that the doctors say the patient, you have finished your treatment, now you have to take this medication and come back after 3 months. And then they don't know what's going on out there. The patient who's palliative has to be under the care of the doctors, but then they are being taken back to the families, and their family caregivers with no prior experience are supposed to take care of them. Did you train these people? Are caregivers aware of what they should do? So this lady here decided to write a book that offers a caregiver in Swahili how to care for your loved ones while you can take care of yourself as well, because there's a lot of pressure that's going on out there. And then we know that people die soon after because we have many palliative care patients, palliative patients. And then you know the burden of the cancer in the society or in the family. As I said, it's extended family. No one follows them through, no programs in place. So she advocates for that because it's a problem that we all should do. And Afia Angels is an organization that me and her have just co-founded, and we are working on implementing the home-based care, especially when it comes to caregivers. And this is Stephen Sanga. He is a cancer education advocate. He is the first Tanzanian to write a Swahili book about cancer, which is Saratani Nini, all about cancer. So this is advocacy by itself. And then there's Miss Ansila Limo, who believes that pain management is the way to go now that we have 8 out of 10 people needing this. So she has a passion in palliative care, and she thinks she can advocate for that, and nothing is impossible. Then you have these other 2 people as well. This is Miss Juliet, who believes that fertility and cancer cannot be separated, because now that people can live longer lives, we know that childhood cancers can be cured, but again, adolescent cancers as well could as well hinder a patient's reproductive abilities. So they would need interventions in place, and we don't have those in place, or rather, nobody knows about them. She advocates for that, and she believes she's a leader in Women in Oncology initiative that we are going to team up with other women to stand for what's best for women in Tanzania. And this is Al Idris. He is the General Secretary of Tanzanian Cancer Society. He's the advocate's advocate. I believe I've been an advocate for as long as I can remember, but this is the kind of guy that when we talk about things, he puts me in line and tries to reduce my ambition, and he knows what we're talking about. So he understands this, and me and him, and together with the team, are ready to cooperate with anyone here who wants to cultivate his innermost call to incorporate that in cancer fights, and we can mentor you very well. So you're all welcome. So these are recommendations that we know that healthcare workers can do more, you can do better. So use the social media platforms. But again, this is a very important thing that I think we all should, I'm just about to finish. This is something that we really believe that we should all do as medical personnel about the e-patient movement. It's out there in the world, it's coming over here, and we need to know how to adapt to that. Look at this example here. A patient Googles her problems, or rather they come to your hospital and they are asking you questions that you think these are coming from Google. Dr. Google, is you blame it. I'm just trying to warn you guys that we should have to conform to what the world is going to. Already out there are e-patients. So you have to understand that patients will come with information that they have, and it's our duty to tell them the truth and or even share the decision-making processes, because you can imagine you have a patient right there, or you can become a patient by yourself. You are educated, you know where to find the right information, the correct information and everything about your health, and then there's a doctor telling you that you took that from Google. Yes, you studied through Google as well. So they know the right information they were looking for, and they're right on, they want to discuss with you. So open your minds and stop thinking that these people are trying to ruin you. They are many, and they are here to stay. So like this is an example that a doctor says that don't confuse your Google search with my 6 years of medical school. And then you have a patient saying that don't confuse the 1 hour lecture you had on my condition with my 20 years of living with it. So there's a little of some confusion there in which we need to advocate for and understand that how we can mitigate our knowledges and sharing with other people as well. As for our researchers, we should be realistic. You don't just copy things from abroad and talk about them here. Our patients in the waiting areas are waiting in the seats that are not even cushioned, and they are in pain. They sit there for a long time, and you don't even know what can be done, but you took these Eurocentric ideas that they have to sit in a waiting area. But ours are thinking about death all the time, and nobody talks about them. It's probably we can improve this by ensuring that the things that we do conform to exactly what our patients are going through, because they sit there and they keep lying to each other, but again, they have the distresses that even discombobulate their minds. So Afrocentric researches and interventions are really, really important. So the quick solutions for researchers, I would like you to remember that you need to reverse your research. While you're thinking your Eurocentric approaches don't really work, you have to start looking from the downward side. It's time to flip the pyramid. You talk to the patients, and then you go upwards and try to see the solutions that you implemented good. So it's time to think from a patient's angle, work with patients, advocates, and we can do much better. For the students, we have a program will be coming at your place. You just do it. Whenever you think that you can do something, just do it. You're faster than you can. Your social media handle is your brand. Brand yourself, pick a cancer, pick an activity that you think you can learn and give back the information to the society to understand that these are things happening out there. You can even help our doctors who are too occupied because they have so many patients. They can even look for topics to go and specialize on. You can talk about those, and they can catch up and do something about it. Even the government decision makers, they need that as well. When you speak about things, that's advocacy, and it can be picked up with the right person at the right time. So medical schools, our cases are different. We only have 2 patients to cure. And then we're specializing in curing while we know that palliative care is something that we really need. So you should have to think about those. It was discussed yesterday, so I had to just bring it today. NGOs and CSOs, we have to have a unified voice. We need to collaborate and form a coalition so we can have one voice. And government and Ministry of Health, we know our countries are all about politics. The politicians have to do something. Just imagine CCM is all over the country. What if they incorporate a cancer awareness segment in what they do? People listen to them when they understand more politicians than they understand us. Why can't we use the politicians to voice all this? So with that in mind, international organizations and funders have to respect and recognize the African ways. They have to find patient experience and navigation projects. We do not have the data you need to support us. Reduce the restrictions. We need more cancer funds, capacity building. We are grateful for the Lancet and Moonshot initiatives, but we really think that they need to do something about the things I've mentioned. And somebody has to advocate for healthcare workers, man. We are working with people we know that they're on the verge of dying, and we are busy working day in and day out. We lose a little bit of touch because we try to dissociate ourselves from what the peoples are going through so that we can stay sane and do things. Somebody has to speak for us. Somebody has to advocate for wellness of mental health of us who are working under very difficult conditions. We were trained from childhood. We know that we work in a hospital, you get somebody better and go back to home. But in our cases, we are just a transition towards death or something like that. It's hurtful. It makes us not human enough sometimes because we need to hide our feelings so that we can carry on with doing other things. We need people to speak to us. I could finish that with this word here from a Kenyan proverb. We have not inherited this land from our ancestors. Rather, we have borrowed it from our children. So we can make the better future if we decide to do the right things today. And that is a wrap. That little kid back there is this guy standing here right now, and still I haven't lost the appetite to change and make things better. I know we can do much more than we can. One life, one fight. Let's build it together and feel all right. What we're beating is the disease that is in front of us. That's cancer. Thank you very much. Thank you for listening. God bless you. This is the day that the Lord has made.